What if the number one reason a child is failing algebra has absolutely nothing to do with math,
Right.
and it has, everything to do with this invisible price tag that their parents are just terrified of? So, welcome to today's deep dive.
It's a heavy question to start with.
It really is. Today we are looking at a really compelling model for K-12 mental health support. It's operating in Georgia right now, and it's called MentalSpace School.
Yeah, and we have a pretty dense stack of sources for this one.
We do. We've got program details, promotional texts, things outlining their specific services, their cost structures, and some really fascinating outcome data.
Exactly.
So, okay, let's unpack this. Because the core tension identified right at the very top of our sources is this massive psychological barrier. The text basically states that the number one reason families don't pursue mental health care for their kids is, well, the assumption that they simply cannot afford it.
Yeah, it is a profound bottleneck. And I'd say my mission today is to really look at how removing this specific barrier, the cost, doesn't just help an individual student in a vacuum.
Right.
It actually creates this measurable ripple effect throughout an entire school ecosystem. When you change that point of entry, you completely redefine the outcome for everyone, the student, the teacher, the administration.
So let's start right there at that bottleneck.
Yeah.
Because before a student can get help, the family has to believe that the help won't, bankrupt them.
Right, which is a very real fear.
Absolutely.
Yeah.
And the sources lay out the exact cost structure, and it is incredibly direct. For families with Georgia Medicaid, the cost is $0.
Zero.
Yeah, zero. It's not like a sliding scale. It's not some complex reimbursement model where you pay out of pocket and then, just pray a check comes in the mail 3 months later.
Right, which happens all the time.
It really does. But here, it's just $0. No copay whatsoever.
That directness is clinically crucial. I mean, navigating healthcare, especially mental health care, is notoriously complex.
Oh, it's a nightmare.
It is. We're talking about a system that's just filled with jargon, shifting networks, and all these hidden fees. When a family is already dealing with a child in crisis, asking them to also become like forensic accountants just to figure out a copay,
Yeah.
that is very often the breaking point.
And it's not just Medicaid either. They detail a really massive private insurance network, too, in the text.
Yeah, they do.
They list Blue Cross, Blue Shield, Cigna, Aetna, UnitedHealthcare, and Humana. And they note that these typically come with pretty low copays.
Right, the major players.
Exactly. Plus, they explicitly say they accept Peach State, CareSource, and AmeriGroup.
Which is key.
Right. And for those of you listening outside of Georgia, or if you're just unfamiliar with the system, those last three are specific Medicaid managed care organizations.
Yeah, so they're essentially casting the widest net possible.
Exactly. To capture almost every student in a given public school. And they anchor all of this with a central philosophy that's stated right in the text. It says, mental health support for your child should never be a luxury. It's health care.
I love that framing.
Me too. Treat this realization like discovering your local public library suddenly offers free, immediate access to top-tier legal or medical advice.
Oh, that's a great analogy.
Thanks. I mean, it shifts something that was previously viewed as an out-of-reach, high-end service for a lot of people into a standard, accessible public utility.
What's fascinating here is the psychological mechanism of what we call perceived cost.
Okay, tell me more about that.
Well, in behavioral economics, perceived cost can be just as prohibitive as the actual cost. There's this concept known as the scarcity mindset.
Right.
When a family is living paycheck to paycheck, their brains are under a constant, really heavy cognitive load.
Yeah.
Having zero financial buffer literally reduces your executive functioning.
Wow. So every single unexpected expense feels like an existential threat.
Exactly. Every single one.
So even if they desperately need the help for their child, the mere thought that making a phone call might trigger a surprise bill, it stops them cold.
Right. They self-select out of the care system before they even try.
It's like walking a tightrope without a net. You just don't take unnecessary steps.
That is a perfect way to visualize it. The administrative dread just paralyzes them. But by loudly and clearly broadcasting $0 for Medicaid and listing out all those managed care organizations, the program directly attacks the root cause of that inaction.
Right. They're removing the tightrope entirely and offering a solid bridge instead.
Yes. They are fundamentally altering the parent's relationship with the school's resources.
So the school is no longer just this place where a guidance counselor hands you a piece of paper with a phone number for a clinic across town.
A clinic you probably can't afford anyway.
Right, or one that has a 6-month waiting list.
Yeah.
The school actually becomes the access point for guaranteed covered health care.
And that transition is profound. But, offering this massive suite of services creates a whole new logistical reality. Oh, I bet.
Yeah. Moving from the promise of access to the actual mechanics of delivering that care, that is where this model gets incredibly ambitious.
Ambitious is honestly an understatement here. Looking at the scope of care in our sources, we are moving way, way beyond a traditional school counselor having a 15-minute chat about study habits.
Right, or handing out college brochures.
Exactly. Let me just list out the specific services they detail here. They are offering same-day teletherapy, dedicated therapist teams assigned to each school, crisis intervention, active suicide, and violence prevention.
It's a huge list.
It really is. And it keeps going. Staff wellness programs and family counseling.
Yeah.
So what does this all mean? Because physically, you can't just drop a massive psychiatric clinic into the middle of a junior high school.
You can't. And that is exactly why the mechanism of delivery is the linchpin of this entire operation.
The teletherapy component. Exactly. They aren't physically building a hospital wing or, taking over half the classrooms. They are routing a massive clinical infrastructure directly into the building through secure technology.
I am trying to visualize how this actually plays out in the real world. Let's say a student is experiencing a severe panic attack in the cafeteria.
Okay.
The traditional model is like a teacher notices the kid gets sent to the nurse or the principal's office. Parents are called at work.
Right.
The parents scramble to find a clinic. And maybe, if they're lucky, they get an intake appointment in 3 to 6 weeks.
That's the standard, unfortunately.
So what does the day-to-day reality look like when a school actually has this same-day teletherapy infrastructure in place?
The contrast is just stark. Instead of that drawn-out administrative nightmare you just described, the distressed student is discreetly guided to a designated, secure, quiet room within the school. They are handed a secure tablet or laptop, and within minutes, they are connected face-to-face with a licensed therapist. And not just any therapist, but one who is part of the dedicated team assigned to that specific school.
Wow. That completely flips the script on how we handle adolescent mental health.
It really does.
Instead of waiting 6 weeks to talk about a panic attack that happened a month and a half ago, you were dealing with it right in the moment. It is the difference between sending a fire investigator to look at the ashes 6 weeks after a fire versus handing the student a fire extinguisher while the flames are actually burning.
That is exactly the clinical advantage. When a student is in crisis, their nervous system is highly dysregulated in that exact moment. They are in fight, flight, or freeze.
Yeah.
Engaging with a licensed professional while the emotional trigger is still fresh means the intervention is active, not retrospective.
That makes so much sense.
The gap between the crisis and the clinical support is basically eliminated, which prevents the trauma from compounding over weeks of waiting.
But looking at the sources, they indicate that this isn't just about putting out immediate fires for individual kids.
Right.
They explicitly include staff wellness and family counseling in their service list. It seems like they're treating the entire environment, not just the student.
They have to. You really cannot treat a student in a vacuum.
Yeah.
A child's mental health is deeply tied to the ecosystems they inhabit.
Their classroom and their living room.
Primarily those two, yes. Think about the classroom ecosystem. If a teacher is burned out, operating in a state of chronic stress, their nervous system is also dysregulated.
Oh, for sure. And kids are incredibly perceptive. They absorb all that tension in the room.
They really do.
A dysregulated adult cannot effectively calm or support a dysregulated student.
Precisely. So by extending therapy and wellness programs to the staff, MentalSpace School is stabilizing the entire educational environment.
That's huge.
And extending it to the family means the coping strategies a student learns during a teletherapy session at 10 a.m. aren't just immediately undone when they go home at 3 p.m.
There is another detail in the sources regarding these therapists that feels really crucial to me.
Oh.
Yeah. They make a major point of highlighting that their licensed therapists are diverse and culturally competent.
Yes. That's vital.
I imagine, for a skeptical teenager staring at a screen, if the person on the other end doesn't understand their cultural background or maybe pathologizes normal cultural behaviors, they are going to immediately shut down.
without a
The
doubt.
therapy won't even start.
You've hit on a major clinical hurdle there. Access doesn't just mean affordability, it means relatability.
Right.
Cultural competence means the therapist actually understands the specific cultural context, the background, the vernacular, and the lived experiences of the student.
Which is so important.
For a teenager, opening up to a stranger is already incredibly vulnerable.
It's terrifying. Let's be real.
It is terrifying. So a diverse, culturally competent team means students are significantly more likely to actually engage with the care. They feel seen and understood.
Yeah.
When a student feels culturally validated, their nervous system naturally downregulates. They feel safe. And feeling safe is the absolute prerequisite for any therapeutic work to happen.
It's the fundamental difference between just physically showing up to an appointment and actually doing the hard, vulnerable work of therapy.
Exactly.
So we've got this massive, holistic, zero-barrier suite of services. The mechanics make sense, but offering this creates a whole new problem.
The legal side.
Right. You can't just drop a clinical medical practice into a public school system without triggering a massive legal collision.
No, you definitely can't.
Which brings us to the logistics, the compliance, and the actual proof of impact in our sources.
Yes, the administrative reality of running healthcare inside an educational institution, it is usually a bureaucratic nightmare.
The sources hit on some very heavy legal frameworks right away. They state the program is fully FPAR and FERPA compliant.
Right.
And they offer compliance support for something called HB 268, specifically noting a looming deadline of July 2026.
That deadline is a big deal.
And then they drop these hard outcomes. 89% improved attendance, 92% reduced anxiety, and 85% family satisfaction.
Those numbers are staggering.
They really are. But let's start with the legal scaffolding first, because I imagine that is the very first question any school superintendent asks before looking at the outcome data.
Oh, absolutely. If we connect this to the bigger picture, the intersection of HIPAA and FERPA is a notorious minefield for school administrators.
Because HIPAA is the federal law that protects healthcare privacy and medical records.
Right. And FERPA is the Family Educational Rights and Privacy Act, which protects educational records.
So when a therapist is treating a student inside a school building, those two massive sets of privacy laws just suddenly smash into each other.
Exactly, because the school is suddenly holding both educational records and medical records.
That is quite the collision.
It really is. Who gets to see what? If a student is talking to a teletherapist about a trauma at home, does the principal have a right to know? Does the homeroom teacher? What goes into the permanent educational file versus the confidential medical file? Managing those overlapping privacy laws usually requires a dedicated full-time legal team.
Which most schools don't have.
Right. So when a program like MentalSpace School states they are seamlessly HIPAA and FERPA compliant, they are essentially acting as the legal buffer.
They are taking that massive liability and administrative burden off the shoulders of the school district.
Yes. They provide the legal armor so the school can just focus on education.
But what about this ticking clock mentioned in the sources? This HB 268 compliance with a deadline of July 2026.
So for those who might not follow state-level educational legislation closely...
Which is most of us, let's be honest.
Fair enough. HB 268 is a specific legislative mandate in Georgia that essentially requires public schools to establish robust, actionable frameworks and policies for student mental health support.
Go ahead.
The vital detail here is the timeline. July 2026 is right around the corner in administrative time.
Oh, absolutely. School districts move slowly. Procuring vendors, testing systems, training staff, that takes years.
Exactly. This deadline acts as a massive catalyst. It means schools no longer just have a moral imperative to improve mental health support.
Right.
They have a legislative mandate with a hard deadline. It forces school boards to stop forming committees to just talk about mental health and actually implement a fully compliant working system.
Okay, let's look at what happens when they actually do implement this compliance system, because here's where it gets really interesting to me.
Let's hear it.
Look at that first statistic from the outcome data. 89% improved attendance.
Yeah.
Think about how we traditionally handle truancy in schools. We almost universally treat it as a behavioral issue, a discipline issue.
Right.
A kid skips class, we give them the detention. They skip again, we send a stern letter home, or we escalate it to a truant officer.
It is entirely a punitive response to what we assume is defiance.
But this data completely upends that assumption. If bringing in a massive zero-cost mental health intervention improves attendance by nearly 90%,
Yeah.
it means truancy isn't primarily a discipline issue at all. It's a healthcare issue, disguised as a behavioral one. We've been treating the cough instead of the disease.
That is a phenomenal insight. And you have to look at the second statistic to truly understand the mechanics of the first one. A 92% reduction in anxiety.
Fix the crippling anxiety, and the student actually shows up to class.
It sounds simple, but it requires a huge paradigm shift in how we view student behavior. Why does a student avoid school? Often, it's not because they are inherently defiant or don't want to learn.
Right.
It's because the environment triggers overwhelming anxiety. Maybe it's severe social anxiety. Maybe it's crushing academic pressure. Or maybe they're dealing with trauma at home and their brain simply cannot focus on algebra.
Going back to that scarcity mindset and cognitive load we talked about earlier.
Exactly.
If a kid is in constant fight or flight mode, sitting still in a brightly lit room for 8 hours feels impossible.
It is impossible for them. If you treat the root cause, the anxiety, through targeted, immediate teletherapy, the symptom, the truancy resolves itself.
Wow.
The data proves that this intervention is not just a nice-to-have emotional support system or a luxury perk. It is a foundational driver of academic success.
Because you can't teach a kid who isn't there.
You cannot teach a student who isn't physically or mentally in the room. This data proves that accessible mental health care gets them in the room and keeps them in the room.
And it leaves the families feeling incredibly supported too. Hence the 85% family satisfaction rate mentioned in the sources.
Right.
It's hard to overstate how revolutionary that feeling of support is for a parent. We talked about the cognitive load of poverty earlier.
Yes.
Imagine being a parent who knows their child is suffering, but feels completely isolated and financially trapped. To suddenly have the school provide a lifeline that actually works and doesn't cost a dime.
It's life-changing.
It changes the entire trajectory of a family.
And from an administrative standpoint, it provides schools with the exact justification they need to act.
Right. The numbers speak for themselves.
When superintendents are looking at tightening budget allocations and looming legislative deadlines like HB 268,
Yeah.
hard clinical outcomes like an 89% improvement in attendance and a 92% reduction in anxiety are the undeniable metrics that allow them to confidently adopt the system.
Which is exactly why the sources make sure to provide direct avenues for contact. They list MentalSpaceSchool.com and MentalSpace School at HEdgeTherapy.com. Right there in the text.
Because they know that any administrator or desperate parent looking at these numbers is going to want to initiate that partnership immediately.
It really is a remarkably complete package.
It is. They identify the financial barrier, provide the technological infrastructure, handle the complex legal compliance, and deliver undesirable academic and clinical outcomes.
It's a massive structural shift in how we think about education and care. So to briefly recap the journey we've taken today, we started by looking at how MentalSpace School tackles the perceived cost barrier head-on, declaring $0 for Georgia Medicaid,
Right.
and leaning into a huge private insurance and managed care network to prove that care is healthcare, not a luxury.
Exactly.
From there, we explored the actual mechanics, how they deploy a holistic array of same-day teletherapy, acting as a fire extinguisher rather than a fire investigator.
I love that analogy.
Thanks. And, extending that care to staff and families. And finally, we saw how navigating the legal collision of HIPAA and FERPA ahead of a 2026 mandate results in these striking statistical improvements,
Yeah.
driving down anxiety by 92% and rocketing attendance up by 89%, proving that a lot of behavioral issues are actually healthcare issues.
The structural impact is undeniably powerful. When you solve for access, the entire ecosystem heals.
It really does. And for you listening, I want you to take a moment and think back to how mental health resources were handled when you were in school.
That's a good exercise.
Think about the kids who just quietly disappeared from the roster, or the ones who are constantly sitting in detention for skipping class. And consider how radically the landscape is shifting right now toward treating those struggles as essential, accessible healthcare.
It's a very different world now.
It really is. For those of you wanting to look deeper into the mechanics of this specific model, you can check out MentalSpaceSchool.com.
It does make you wonder about the long-term implications of this shift.
How so?
Well, if a school fully integrates this level of comprehensive, zero-barrier mental health care seamlessly into the academic day, could the traditional wall between educational support and healthcare eventually disappear entirely?
Wow.
And if it does disappear, what else about our traditional schooling model will we need to fundamentally rethink?
Yeah, it's a fascinating question to leave on. Maybe the reason so many students have been struggling wasn't a lack of discipline or a lack of intelligence. Maybe it was just an outdated definition of what a school is actually supposed to provide.